You're Hello, everyone. Joining. This is Sexuality and Health Wellness. And on the episode of this live chat or live video, we're going to be doing a whole lot because we'll be showing us how to, number one, put on condom, the right way to put on condom. And I will be entertaining questions. So if you've got questions, you can go ahead and ask your questions um, based on the topic we have for today or any other topic so far it is related to sexuality and of course health wellness. So I'd love us to state where we are joining from and state where you're joining from. Let us know where you're joining from, okay? Let us know where you are joining from. I am Noskansi Andama, and this is Sexuality and Health Wellness. This is Sexuality and Health Wellness. Once in a week or once in a while, we have our live chat. This is basically where everyone gathers and we talk about different things. We answer questions and of course we deliberate on different matters, bringing perspective and looking from different angles, of course. So let us know where you're joining from. Let us know where you are joining from. Okay, here I got a condom. And like I stated earlier, I will be showing us the right way. So I was thinking, what is the best tool to use to do the demonstration? I don't know. I felt this deodorant is, good enough. I mean, that is the closest I have to what a penis looks like, right? I think so. What do you guys think? So we'll be describing or we'll be demonstrating, that's the English, the best and the right way to put on a condom. All right. So, like I stated earlier, if you are just joining, you can give us a thumbs up and, of course, try as much as possible to subscribe. All right. So that subsequent live videos, which, of course, is educational, you will get a notification on that. Come on, Mr. Sly Pro Max. This. Oh well, no. I bought it with my price, my money. I bought it with a price. I bought it with my money. So the deodorants have to serve a purpose. It doesn't have any option. It has to serve a purpose. And for this reason, for this purpose, I have called it out from where I kept it so that it will, to serve us today. All right. So, for others joining us, like I stated earlier, we're going to demonstrate the right and the appropriate way. And of course, the checks you're supposed to make before you put on a condom. Okay. I have been in a hospital where this lady walked in. See, you guys should not mind the fan I am holding. You know where I am. So, come on. So, I have been in the hospital and this lady walked in. I just want to give us a very short story before we start this. Okay. So I've been in a hospital. A lady walked in with a young guy. So, one thing about us is we're very good with observation. We observe a lot. We may not talk too much, but we observe. We observe a lot. Before we talk, we have observed, and we have long been observing, like we're very observant. So the lady walked in and the guy followed suit, and I looked, and of course I observed. You understand? So when I looked, I said, I scanned the both of them. I said, These are young people. What are they doing? Hi, how are you doing? Okay, this is da 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 hospital. Um, what do you want us to help you with? Because that is how you welcome someone, right? So, what do you want us to help you with? We're at your service and all that. So the lady was like, nurse. I said, yes. And when patients want to be confidential, they want to pass an information, or probably they need an answer, but it's kind of confidential, right? There is a way they speak. So she spoke in that manner. I picked that I picked the whole body language and all of that. I was like, okay, what is it? I moved with her to a particular place, and then I was like, what is it? You can talk to me. What is it? So she said, nurse, I have a question and it is bothering me. I said, sure, ask your question. Shoot. She said, I came for scan. I said, okay, but the price is outrageous because we do scan. It's a diagnostic center. The price is outrageous. I said, okay, so what is the problem? Um, what do you think is another option you can explore since you can't afford the scan? She said, I don't know, but we don't have the money now, so we want to go. I said, we? I said, well, I said, okay, no problem. Then she was like, she wanted to go. Then she was like, this is not, hi, Johnny. You only may, I don't know if I pronounced that right, but John, I can see you. Hi. So I'm telling the story, but I want to do some demonstration here, the right way to put on a condom, right? So you guys should stick around. I am fine. Thank you, John. Thank you so much. I'm fine. And I hope you're well. Okay, so we're gonna do the demonstration after my story, please. I tell story a lot because we see a lot in the healthcare section. So she proceeded, or she went ahead to ask some other questions. So she was like, the thing is, I stopped seeing my. No, she said she's pregnant. That was what she said. I am pregnant. That was what she said. I said, oh, okay, that's a very wonderful thing. Congratulations. Then she went ahead to say that she wasn't feeling the congratulations, so whatever. Thank you. But she wasn't like, thank you, clock it. No, she wasn't clocking it. I was like, oh, okay. Okay, sorry. No, she wasn't clocking it. So I was like, okay. So she proceeded to complete the statement she had. She wanted to state. So she was like, the thing is, I don't know if we give drugs that remove babies. I say, Kai. At that moment, I was like, no, no, I can never turn back. Oh, no, no. It's already too late. Oh, no, no, no going back. Do you know why? Because my faith, we don't do such thing, right? Not because I'm trying to be judgmental. Hello, Hamadalota Taibi. Hello, Hama. How are you? I can see you. I can sight you. Hi. So thanks for joining us. Stick around. We're trying to do some demonstrations here, the right way to put on condom, but I'm telling the story. So listen to my story, even if it's boring. But no, my stories are not boring. Trust me. So my stories are not boring. So listen. So my stories are always educational, and you're gonna get something. All right. I can see you, Hama. Thanks for joining. So when she said that, like I stated earlier, I was like, no, this is against my faith, right? And because it's against my faith, I don't do it, and I don't aid people to do it. Okay, I don't do it, and I don't aid people to do it. I've had another client come to me and was like, I need you to give me advice on how to get rid of the baby. Okay, I mean, no 101 ways to do that, right? I mean, no 101 ways to do that. Okay, Hama, we are in this live, we are going to be describing the best and the right way to put on a condom, male condom, actually. Yeah, but I believe male and female, it is right for you to know it. Because if your boyfriend does not, you correct him with love. So, brethren, back to what we're saying. So I don't had another person that was like, I want to, and I said, like I stated, I mean, no 101 ways to get that done smoothly, swiftly, and whatever you can think of, but no. I won't aid you and I don't practice it. Okay? Why? Because it is against my faith. So when she said that, I said, I'm sorry. At this point, I'm so sorry. I would have loved to help you, but I am so sorry. Okay, Hama, you have never used it. But trust me, there will be a time when you will use condom. Okay? When you get married, you may want to use condom as one of the ways for one of the family planning method or contraceptive method, although it is not really like it's non-hormonal contraceptive. So this is a non-hormonal contraceptive. And as much as I can advise us, I think it's best if you can. Kai, it is best to use non-hormonals as a way to prevent pregnancy, especially when you are married, because once you get married, even if you guys are done having babies, you may still want to. I mean, that's a me. You will want to